So we will continue our topic on drugs for cough. Today we are going to talk about our antitussive group of the drugs. So what are antitussives? We will now talk it about. So antitussives are those group of drugs that are used basically to control the cough. They are not going to eliminate our cough. They are just we are given for controlling the cough. They do not eliminate or do not treat the exact reason why the cough is occurring. They only control the cough. And these antitussives group of drug, they are basically we prescribe them for dry cough and the cough where the patient has non-productive nature of the cough and dry cough, and this is unduly irritating to the patient, and for that purpose we give these antitussives group of drug. So what these drugs do, these drugs basically act on the central nervous system in the cough center. In the central nervous system in the cough center, these groups of drug act, and besides the central nervous system they also act in the periphery, in the respiratory tract. In the periphery it also acts on the respiratory tract, these antitussives group of the drug. So we now see what is the mechanism, how the cough occurs, and how this group of drugs, the antitussives, act. So what happens when the patient is having the lot of chemicals or irritant or any mucus that is irritating the respiratory passages? So normally the what happens is that there are certain impulses that are being generated, and these impulses are generated from the respiratory passages, and these impulses goes to the cough center, which is located in the medulla. Here it is our cough center, this is the cough center, and it is located in the medulla oblongata. Here is our the cough center. So what happens when there is a lot of irritation and smoke particle inhale or foreign particle goes to the respiratory tract, these impulses then goes to the center, that is the cough center in the medulla oblongata. Here is the cough center, and when these impulses stimulate this cough center, so what happens, there is initiation of cough reflux through various muscles that are being stimulated from these impulses. These muscles of the vocal cords are stimulated, and muscles of the larynx, pharynx, abdominal muscles, and all those muscles that work in a coordinated way to initiate the cough reflux. So this is the normally how does the cough happens. So what these antitussives group of drug do, they basically act at two levels. First they act at the cough center level and also act at the periphery in the respiratory tract. So these impulses which are generated in the periphery, these are called the tussle impulses. These are called the tussle impulses. So these tussle impulses, or when we give these drugs, the antitussives group of drugs, they basically inhibit these tussle impulses, and this leads to decrease, or the cough center is unable to get stimulated because of the inhibition of these impulses. So there is no more impulses reaching the cough center, and that's why the cough is not initiated, and the cough is getting controlled with the use of these antitussive group of drug. So here it is inhibiting the tussle impulses, and also these drugs also increases the threshold of the cough center for cough. So they increase the threshold of cough center. So they increase the threshold of cough center. So normally there are receptors which are present here in the cough center. These receptors basically, these receptors senses the stimuli, irritant stimuli, and because of the raised threshold of this they require a lot of irritant molecules now to stimulate the center. Initially it may be with normal spaced, with two molecules suppose if stimulate the this cough center. Now because we have given the antitussives, we require say 10 molecules now to stimulate this cough center. So they increase the threshold, they increase the threshold of cough center. So normally with 2 molecules of irritant, suppose the cough center is getting stimulated. Now with 10 molecules, at least 10 molecules are required to stimulate this cough center. So in this way, these antitussive groups of drug act at two levels. First at the cough center level, where they increase the threshold of the cough center, and at the periphery in the respiratory tract, they inhibit the tussle impulses. Now we'll see the classification of antitussive group of drugs. The classification of antitussives. Antitussives are classified as opioids, non-opioids. Besides opioid and non-opioids, we have the antihistamines and peripherally acting antitussives drugs. In the opioid group of drugs, we have the drugs like codeine, which is a standardized antitussive, which is also the methyl morphine, and then we have the ethyl morphine and pholcodeine. Then among the non-opioids, we have the noscapine, dextromethorphan, clofenidianol. These are the non-opioids. Among the antihistaminics, the antitussive group among the antihistaminics include the chlorpheniramine, diphenhydramine, promethazine. And in the peripheral acting antitussive group of drug, we have the prenoxdiazine. So these are the classification of antidepressives. We have the opioids, non-opioids, antihistaminics, and peripherally acting antidepressives. So first talk about the opioid groups of drug. So as we know, these are the opioids, antidepressives. They act on the mu receptors, which are present on the cuff center in the medulla oblongata. They act on the mu receptors of the brain. In the central nervous system, in the cuff center, we have the mu receptors. These opioid groups of drugs act on the mu receptors present on the brain in the central nervous system. And as we know, mu receptors is being blocked by another drug known as the naloxone. Naloxone. So naloxone is the antagonist for these group of drugs. Naloxone is the antagonist. They block the mu receptors. They block the mu receptors on the central nervous system. So among the opioids, the standard drug is the codeine. It is the standard antitussive. It is the standard antitussives. It is the standard antitussive, and its duration of action is 6 hours. Its duration of action is 6 hours, and as we know, it suppresses the curve by acting on the central nervous system. And this codeine has a drawback of side. It cause drawback is it cause constipation as its major drawback. Besides constipation, it has addiction liability. It cause addiction, and it also cause sedation. Since it causes sedation, it is to be used very cautiously in patients who are drivers. So patients should not drive while taking codeine tablets. So it causes constipation, addiction, sedation, and at larger doses it can cause respiratory depression also. So that's why it is contraindicated in patients who are having poor respiratory drive. They are contraindicated, and also it is contraindicated in asthmatics. It is contraindicated in asthmatics. So codeine comes in the form of syrup as well as tablet. As we can see, it is 30 mg. The doses of codeine is 15 to 30 mg tablets comes. And also there is a syrup which comes in the form of Linctus as codeine phosphate. Here we can see codeine phosphate Linctus. So its 5 ml contains about 15 mg of codeine in it. 15 mg. So codeine, as we know, it is a standard antitussive. It is having the half-life of its action is of 6 hours. And this drug is also avoided. Should be avoided in children. It should be avoided in children. So this was about the codeine. Now another drug is your ethyl morphine. Ethyl morphine. Codeine was methyl morphine. Another drug is ethyl morphine. About this drug is closely related to the codeine, and its action and efficacy is almost similar to your codeine, and but it is less constipating. It is less constipating drug when compared with codeine. It is less constipating, and its dose is 10 to 30 mg given thrice daily, TDS dose. This is the dose of ethyl morphine, and it also comes in the tablet form as its name is deonindone, deonindone, and it is comes as 16 mg tablet. Deonindone. This is ethyl morphine. Now we'll talk another drug is your fall codeine. We have the fall codeine. Fall codeine. This drug has no analgesic properties, no analgesic, and it also has no addiction property, no addiction and non-analgesic. So this is for fall codeine, non-analgesic, no addiction liability. But its efficacy is as antitussive is similar to codeine. Efficacy is similar, but the important thing about fall codeine that it is a longer acting drug. It acts for 12 hours when compared with codeine, which acts for 6 hours. It acts for 12 hours, and the dose of fall codeine is 10 to 15 mg. So this was about fall